Good morning, everyone, and thank you so much for joining us on New Day Cleveland. I am Natalie Herbeck. Happy to have you with us. Wearing red today because it's all about our hearts. So we're going to get right to it. One of the best joining us here in studio. Dr. Leslie Cho is here to start things out. The Cleveland Clinic, they do these annual surveys to better understand patients' needs, which is also wonderful that they're doing this. And this year's survey showed something really interesting. And I know it seems, Dr. Cho, that we're very optimistic about our health, which can be good, but not always good, right?
Right. I mean, you know, Americans are optimistic, and that's one of the greatest strengths of our country, to be optimistic, but we're overly optimistic about our cardiac health. And the survey found that even though 70% of our patients had cardiac risk factors, they didn't really know that that was a cardiac risk factor, which is shocking.
At what age should should everyone at some point establish themselves with a cardiologist?
No, I think everyone should establish their risk with their primary care doctor.
Okay.
And I think that there are people in whom you should see a cardiologist. So people with significant family history of early heart disease should be seeing a cardiologist. I think, you know, people who have difficulty controlling their blood pressure or their cholesterol, they should be seeing a cardiologist.
So we're looking right now at some of the heart risks, as you mentioned, high cholesterol, blood pressure, the family history, obesity, poor diet. I think that's something that in America, unfortunately, we love our good fast food, our sweets, but it is really something we need to be focused on if we're wanting to live that healthier life.
Absolutely. You know, it's about longevity too, and about the quality of your life. And we know that diet is critically important in how well you live, how long you live. Diet increases our risk of high blood pressure, diabetes, high cholesterol, as well as cancer, right? We don't often think about that. And dementia.
And that is something, that risk I don't think people correlate to as well. We were just looking at some, and talking about longevity, we're looking some options that people can have for longevity. Is that something that everyone can attain? When we hear that word longevity, we all want to live our best, longest life. But these are some of the main things that we need to be doing in order to come to that place in our life.
Absolutely. I mean, you know, longevity is not, like, we often think like, you know what, I'm going to live just as long as my parents, or now it's written in stone. It's really not written in stone. And there's good data that even if you have the world's worst family history, you can still live longer, but you can also live better, higher quality of life. So I think that's one of the great messages in modern medicine, is that 90% of heart disease are risk factors that you can control yourself. Isn't that amazing?
When you hear those numbers,
yeah,
you realize, because I think some people sometimes think, oh, it's just genetics, there's nothing I can do.
That's right.
And that's absolutely not the case. Most of it is in our control.
You can absolutely control it. I mean, even if you have the world's worst family history, you can eat better, you can exercise more, you can really have an impact on how well you live. You know, I often see patients who say, you know what, what's the point? The point is, how do you want to live your life? Do you want to live that life in a hospital, getting recurrent stents or getting bypass surgery? Or do you want to live your life at home, exercising, you know, traveling, living your best life?
Now, I know that things are always changing. You're always learning things. I know at one point there were thoughts about a daily glass of wine at night would be bad for you. Is that still the case, or has that changed?
Oh, sorry.
It's okay. We need to hear this, right? It's important.
Yeah. Unfortunately, alcohol increases our risk for high blood pressure, something called atrial fibrillation, which is when your top part of your heart doesn't beat in conjunction with bottom part of our heart. Alcohol also increases the risk of cancer. You know, it's been known since the 1980s that alcohol increases the risk of cancer, and yet somehow
it's overlooked.
Yeah.
And we still keep. It seems like younger generations are steering away from it, for whether or not that's the reasoning for it, but it's good news.
Yeah.
Because, again, these are risk factors we can't control. What about the signs or symptoms we should not be ignoring when it comes to our heart, and making sure we either go to that primary care doctor or get to a cardiologist?
Shortness of breath is never normal. So if you're short of breath, walking and doing your daily activity, let's say you could walk 3 blocks last year and you were not short of breath, but now you're short of breath, you should go see someone. You're dizzy, you're lightheaded, you're fainting, absolutely, you should go see someone. You know, high blood pressure doesn't hurt, but when you have really high blood pressure, people get headaches, especially in the back of their head. And it's an important sign you should go see someone. If you have premature family history of heart disease, please go get seen. You know, getting simple blood tests. You know, sometimes people don't want to go see a doctor because they're scared and they don't want to know. If you don't know.
Yes, a lot of people I feel like are like that.
Yeah, and there's a denial aspect, but there's great options now. And it doesn't all have to involve medicine. You know, oftentimes people are like, oh, I don't want to take meds and I don't want to go see. But there are other things. So please go see your doctor.
Well, and starting with something small and maybe one medication is much better off than down the road ignoring these symptoms and having to take several medications or several surgeries later.
Absolutely.
Absolutely. You know, let's weigh things out, right?
You know, you've actually hit it on the head right there. So the goal is for you to not have a heart attack, not have a stroke, and not have dementia. How we get you there, whether it's one medicine or 3 medicine, the goal is not medicine. The goal is to not have a heart attack, to not have bypass surgery or stent, not have vascular dementia, and to live longer. That's the goal. And we have to focus on that goal.
Isn't she just a wealth of knowledge? So here is the deal. She's sticking around. We're going to talk with another specific point with her in just a moment. But I just want to remind you, all hour long, the focus is going to be on our heart health. And this is your chance to ask any questions. You can email them right now to newday@fox8.com. We'll answer as many as time allows. And coming up next, we'll talk with Dr. Cho about how hormones affect our heart health. We'll be right back.